is the health secretary for California, Dr. Mark Ghaly. Welcome back to the show. And by the way, I love your kids' art behind you.
Thanks a lot, and I'll let them know. They'll be thrilled they have fans.
Okay, well, speaking of kids, let's talk about the new guidance when it comes to schools. The CDC put out guidance last week saying that those in schools that have been vaccinated don't have to wear masks. Teachers don't have to wear masks if they've been vaccinated. California with different guidance. Why is the CDC wrong?
Well, so first off, Alex, it's not that they're wrong. We actually think we're perfectly aligned with the CDC. If you look closely at what the CDC said, they said if you can do some other things like create physical distance between students, have robust testing, have masking for unvaccinated kids. So remember, probably more than 3/4 of our students in the state are unvaccinated, either because they haven't been vaccinated yet or they're just ineligible based on age. So we actually chose a plan that helps us feel really confident we're going to get all kids back. It's within the CDC. We say it aligns with the CDC. We've had conversations with the CDC about it and feel in a state like ours where masking has been so effective and helpful for us, and where many school districts can't achieve a minimum requirement of physical distancing, that starting the school year off with full masks for all students is the right way to go.
What about school districts, schools where they can achieve the 3 feet of distance? Why shouldn't they be able to take off the mask?
Yeah, we just think that for so many different reasons, some are about our concerns about where COVID is heading and making sure that we set ourselves up for success no matter what happens with transmission rates in the next many weeks. And then for some districts, it's about operational simplicity, having confidence that they don't have to meet physical distancing requirements. Even if they could do it in one school, they might not be able to achieve it in another school. Some classrooms can do it, but not every classroom in the same building can. So we've heard and had good dialogue with school administrators throughout the state, hearing that this is this sort of certainty and assurance of, hey, there's no physical distancing requirement, but we know what we're going to be doing with masking is going to be the more surefire way to get all kids back. And, you know, in some places it's about 4 weeks away.
So should every single school district in the state, every single public school in the state be back to in-person learning by this fall?
Number one goal, we've been laser focused on it for months now. We were really pleased to see that as the number one priority, and the CDC guidance aligns perfectly with ours. I call this our all school, all kids, all day long in person for the fall plan, and we believe we're going to get it.
All right, let's talk about a few other things. Concerning to a lot of people, especially people that are unvaccinated, is the Delta variant. What should people know about that, and what is the California plan to deal with that?
Well, I mean, you hit the nail on the head, Alex, with the unvaccinated focus. This is a disease now that's really affecting those who are unvaccinated, whether it's case numbers, whether it's hospitalizations, whether it's deaths. All of that we're seeing in such high volume among the unvaccinated, where we're seeing really low numbers among vaccinated individuals. So in some ways, the Delta variant isn't, I kind of joke and say it's not our grandma's COVID anymore. It's COVID that has mutated, changed, become a little bit more transmissible. So those who thought, I'm not going to get infected, I'm pretty safe, I do these things, I kind of know what's coming. Delta changes that in significant ways, and we want to make sure that unvaccinated Californians who can get vaccinated know that this is the time to do it. All of the individuals who are in hospital beds today are because of COVID are unvaccinated.
Are you concerned that the news today about Johnson & Johnson and that it potentially having some rare side effects in people could increase vaccine hesitancy? You yourself got the Johnson & Johnson vaccine. You gave Governor Newsom the Johnson & Johnson vaccine. And are you sort of wishing that maybe you took Pfizer?
Oh, no. I think, look, we are continuing to study and understand certain things that happen with these vaccines, like we do all vaccines and all medications. I am not minimizing this. I think this is a very important news. We need to communicate it clearly and concisely and early to people so they can be informed about what they have received and what they might be considering taking in the future. But I personally have no regrets, no concerns. I think that these are extremely rare situations, ones that we have to take seriously nonetheless. But overall, in my calculation, and I think one thing to communicate is the potential concerns around the vaccine are outweighed by the clear protection we're seeing because of the vaccine when we look at what's happening with transmission today, Delta variants, other variants that are coming, that we still feel really confident about the overall benefit of these vaccinations.
By the way, how excited was the governor to show off his arms during that little exchange?
Oh, yeah, no, I think that those are special moments when we get to not just show off the arms, but show off the resolve and will to go and get vaccinated. We think it's an important decision for all Californians to be making, together with real aggressive and important communication about the benefits of the vaccines, just like we're having this conversation today. We're doing door knocking and phone banking, pop-up vaccine sites in some communities where the penetration hasn't been as great as we want to see. And then obviously with Delta and concerns there, we believe more people might be interested and ready to get vaccinated. So we're just sort of staying in the ready position as much as possible. And incentives is a important piece, but it isn't the full story. I think you got to judge all of these things together.
And lastly, this is the first time I've gotten to talk to you since June 15th, when the state reopened. Obviously, there's a lot of reason to still be concerned, but there's also a lot of progress that we've made as a state. Some of your kids' artwork behind you, you're getting to spend more time with the family, go to things like soccer games for the kids now. What has been the most exciting part of the post-June 15th reality of California being reopened for you personally?
Well, I think you hit it. It's the ability to confidently and comfortably spend time with family, knowing that, hey, we still have to be cautious. Only half of my household is vaccinated. My 3 younger kids aren't. My oldest daughter is. But the opportunity to be outside and enjoy California for all that it's worth has been tremendous. And, one of my kids is in an all-star baseball game. The other's starting to play tennis tournaments again. They're spending time, they're getting back to the things that they missed. And this idea of getting back full person with all their friends to school, even with masks, but that opportunity, I think they're really looking forward to it. So that's been really special. And to see families across the state everywhere I go doing the same thing has been really, really great.
Of course, Dr. Ghaly is married to the other Dr. Ghaly, who our viewers are well familiar with. LA County's one of her top doctors for public health, but it's clear the real stars of their house are the artists who have a gallery behind him. Thank you so much, Dr. Ghaly. Great to see you.
Yeah, great seeing you, and thanks.